the social determinants of health or social drivers of health. These are the social conditions that people find themselves in, places that they live and work and go to school. Those environments can predispose someone to higher rates of all diseases, quite frankly, but particularly diseases where stigma is a concern. If there's poverty, if there's unstable housing, all those things contribute to the higher rates. And I'll give you a prime example. Some of my patients who need to engage in relationships in order to have a place to stay. Well, now that makes them vulnerable to having sex in order to have a place to lay their head. It might mean they may have to have sex in order to have food to eat. And so when you're trying to negotiate how you eat, where you live, and if sex is the only commodity that you have, but yet this person is having relations with other people for maybe similar reasons, it puts your rate of HIV contraction that much higher. People living with HIV tend to have higher rates of distress, higher risk and rates of anxiety, higher rates of depression. And those things tend to be like a trigger or feedback mechanism. So these are the things that healthcare providers, particularly those of us who are taking care of HIV patients, have to consider. It's one of the reasons why we have to practice with a wide lens and not just treat the virus itself,